I'm Atul Bagul. I'm a surgical consultant working at the University Hospitals of Leicester, and my private practice covers working at Spy Hospital Leicester and the Nuffield Hospital at Leicester. So any patient diagnosed with gallstones, which is usually with a help of an ultrasound scan as the most routine investigation, or sometimes with other investigations like a CT scan, and these gallstones cause them symptoms, then the advice is to get your gallbladder removed, which is usually with keyhole surgery. Now these symptoms can be pain, which is usually after eating a big meal, infection, pancreatitis, which is inflammation in the pancreas gland because of a stone slipping down the pipework and causing problems, or obstructive jaundice, where you become yellow, where a stone slips down into the pipework and blocks the duct. So the benefits of the surgical procedure are basically to relieve your symptoms, and very importantly, they are to prevent serious life-threatening complications which can happen with gallstones, such as pancreatitis, which can basically have an impact on your life, obstructive jaundice, and inflammation in the pipework. So some patients can complain of post-operative pain or discomfort. This usually settles down with painkillers. You take simple painkillers you take as tablet format. Now, no surgical procedure is associated without any risks. There are risks such as bile leak. This happens in about 4 or 5% of patients. There's a risk of a retained stone in the pipework, which can be dealt with a telescope test at a later date. Sometimes you can get infection, and this can be treated with antibiotics. Rarely there can be bleeding. In addition to this, damage to the bile ducts. This happens in about 1 in 1,000 patients. And very, very rarely you can have damage to surrounding structures like the bowel or the liver, and then we need to convert to open surgery. Again, this would happen in 1 in 100 patients. And the last complication we need to be aware of is diarrhea. Now, this tends to settle down with time because the bile salts are, take their own time to adjust to be reabsorbed. Now, removal of the gallbladder surgery is associated with very low risks. Now, as with any surgical procedure, these risks are not zero. Now, comparative to other surgical procedures, the risks are low, and we have to remember this is probably one of the most common surgical procedures in the world. Now, usually this is day case surgery procedure, meaning you come in, you go home the same day. Now, some patients may stay in a bit longer, and of course, this depends on various reasons. An example would be you come in, have your surgery late in the evening, and of course, it takes time for you to recover to go home the next day. And of course, everyone is an individual in yourself. It takes time to get over the medications from the anesthetic. Once you're ready to go home, we send you home. Yes, the whole aim of surgery is to remove the gallbladder causing problems, and very importantly, it is to prevent life-threatening symptoms. So once you've had your surgical procedure, you should be back to your routine activity in the next couple of weeks.